Imagine this situation. A man attends a family wedding. There is delicious food everywhere: biryani, sweets, cold drinks, desserts. But he quietly sits in a corner with a small plate of plain food and a tiny cup of water. His friends ask, "Why aren't you eating?" He smiles and says, "I can't. My kidneys have stopped working." He must limit water, limit salt, avoid many foods, and travel to a hospital 3 times a week for dialysis just to stay alive. The shocking truth? Many people reach this stage without even knowing their kidneys were failing. Today, we will talk about a disease called chronic kidney disease, a silent disease that slowly damages the kidneys for years before symptoms appear. In this video, you will learn how to detect kidney disease early, the real symptoms people ignore, why diabetes and BP damage kidneys, what dialysis actually does, real struggles kidney patients face, myths and facts about kidney disease, and how you can protect your kidneys. What do kidneys actually do? Many people think kidneys only make urine, but kidneys perform many vital functions. They remove waste toxins from blood, control fluid balance, regulate blood pressure, balance electrolytes like potassium and sodium, produce hormone for red blood cells, maintain bone health by activating vitamin D. When kidneys fail, all these systems get affected. What is chronic kidney disease? Chronic kidney disease is a condition where the kidneys gradually lose their ability to filter blood over months or years. Kidneys contain millions of tiny filtering units called nephron. When these units get damaged, waste starts accumulating in the body. A question for you. Can a person lose 90% kidney function and still feel normal? Answer: yes. That is why CKD is often called a silent disease. How kidney damage happens. Let's understand the process simply. First, kidney filters get injured. Common causes include diabetes, high blood pressure, infections, toxins. 2 important diseases responsible for most kidney failure are type 2 diabetes, hypertension. Because of damage, some nephrons stop working. The remaining nephrons try to work harder to compensate. This process is called hyperfiltration. Over time, this extra pressure damages the remaining nephrons. Slowly, scarring occurs, filtration decreases, waste accumulates in blood. Finally, the kidneys stop working. Acute versus chronic kidney disease. Many people ask, is kidney failure always permanent? Not always. There is another condition called acute kidney injury. This is sudden kidney failure that happens within hours or days. Common causes: severe dehydration, infection, blood loss, certain medicines. Unlike CKD, acute kidney injury may recover if treated early. How CKD is diagnosed. Kidney disease is detected mainly through blood and urine tests. Serum creatinine. Serum creatinine test. Creatinine is a waste product filtered by kidneys. Normal value: men 0.7, 1.3 milligrams DL. Women 0.6, 1.1 milligrams DL. When kidneys fail, creatinine may rise to 3, 5, 10, or even higher. Blood urea. Another test measures blood urea, nitrogen. Normal blood urea, 720 milligrams DL. In kidney failure, it may increase to 100 milligrams DL or more. GFR test. Doctors also calculate glomerular filtration rate. GFR tells us how well kidneys filter blood. Stages of CKD. Stage 1 GFR is greater than or equal to 90. Stage 2 GFR 60 to 89. Stage 3 GFR 30 to 59. Stage 4 GFR 15 to 29. Stage 5 GFR is less than 1/5 kidney failure. At stage 5, patients usually need dialysis or transplant. Early signs people ignore. Ask yourself this question. Do these symptoms look harmless? Swelling in feet, tiredness, fome, urine, poor appetite, frequent night urination, itching skin. These may be early signs of kidney disease. Many patients suffer from poor sleep. They may have restless leg syndrome or sleep apnea. Symptoms include inability to sleep, leg discomfort at night, frequent awakening, daytime fatigue. Kidney disease affects every part of life. Imagine going to a restaurant. Everyone orders pizza, fried food, cold drinks. But CKD patients must ask, is this food low in salt? Does it contain potassium? How much fluid is there? Often they must avoid many dishes. At weddings, they may only eat small portions of plain food. This causes emotional stress and social isolation. Many dialysis patients can drink only 500–800 milliliters fluid per day. Imagine feeling thirsty on a hot day but being unable to drink water. Medicines used in CKD treatment depends on stage. Medicines for blood pressure, ACE inhibitors, and ARBs protect kidneys. Medicines for anemia. Kidneys produce hormone for red blood cells. When this stops, doctors give injections like erythropoietin or darbepoetin. These are called anemia factor injections. Treatment for metabolic acidosis. CKD patients often develop acid buildup. Doctors prescribe sodium bicarbonate to correct metabolic acidosis. Phosphate binders used to control phosphorus levels. Examples include sevelamer. Dialysis, how it works. Dialysis replaces kidney function by removing toxins, extra fluid, electrolytes, hemodialysis. Blood passes through a machine called a dialyzer. This acts like an artificial kidney. Treatment is usually 3 times per week for 4 hours. Peritoneal dialysis uses the lining of abdomen to filter blood. This can be done at home. AV fistula, lifeline for dialysis. Doctors create a special connection called arteriovenous fistula. It connects an artery and vein to allow high blood flow. Important care of the fistula arm patients must remember. Do not carry heavy bags with that arm. No blood pressure measurement. No blood collection. No cadre injection. Avoid tight clothing. Avoid sleeping on that arm. Patients should check daily for vibration called thrill. If thrill disappears, they must see a doctor immediately. Average cost of dialysis in India. Government hospitals $502,000 per session. Private hospitals $2,000 to $5,000 per session. Monthly cost may reach $30,000 to $60,000. Government schemes like Pradhan Mantri National Dialysis Program provide free dialysis in many centers. Let me ask you a question. Myth: kidney disease always causes severe pain. Fact: most kidney disease causes no pain at all. Myth: drinking lots of water cures kidney disease. Fact: too much water can actually worsen swelling in advanced CKD. Myth: only elderly people get kidney failure. Fact: even young adults can develop kidney disease. Myth: herbal medicines are safe. Fact: some herbal medicines can severely damage kidneys. Future treatments under research. Scientists are developing exciting new technologies. Possible future treatments include implantable artificial kidneys, wearable dialysis machines, lab-grown kidneys, regenerative therapies like stem cell therapy. These innovations may transform kidney treatment in the future. Caregiver well-being. Living with a CKD patient can be emotionally challenging. Caregivers should share responsibilities, maintain their own health, take breaks, seek emotional support. A healthy caregiver can provide better care for the patient. Kidney disease rarely announces itself loudly. It whispers quietly through small signs. By the time many people notice symptoms, damage is already severe. But the good news is this: early testing can save kidneys. Simple tests like creatinine, urine protein, blood pressure can detect kidney disease early. Protect your kidneys, because once they fail, life changes forever. If this video helped you understand kidney health, please share it with friends and family. You may help someone detect kidney disease early. And don't forget to subscribe to @Skariva for more life-saving health awareness videos.